Medicare. It's almost a new year. You may be thinking about this year being the year you're ready to retire. Today, Medicare Tips with Andrew, we're going to talk about a few tips to help make that decision a little easier. Good morning, Andrew. How are you doing?
I'm doing great.
A lot of people, this could be 2024, could you be the year that they retire? What are some factors they need to keep in mind?
So usually the two biggest factors when you're looking at retiring is one, if you can afford to retire with your income, but then the other side of that token is your health insurance.
Okay. And you know, a lot of people, they think they work until 65 and they automatically go onto Medicare. But there's some other options available before you even get to that age that includes Medicare, but other things as well.
Right, so a lot of people feel like they have to wait till they turn 65 and get their Medicare, but now there's actually some health insurance options for people before they go into Medicare, before they turn 65.
So what has happened in the past few years that allow for these affordable health plans?
So one, there's no health questions. So you can have pre-existing conditions, you can have, you know, diabetes and congestive heart failure and things like that, and the health insurance companies don't ask any questions. And then also the health insurance premiums are actually based on your income. So when you retire and you have a lower income, you can get affordable health insurance.
Now when you say low-cost health insurance, what exactly does that mean?
So I actually ran some rates that are going to come up. And so for a couple in their 60s,
and we're looking at those?
Making around $60,000 a year, you can get a decent health plan for about $94 a month.
And that does sound really affordable.
It really is, and that's what people don't realize is these tax credits, and it's a tax credit just like any other tax credit, and it pays straight to the health insurance company that allows you to get affordable health insurance.
And bottom line, this is what you do. You help take the stress out of all of these, all those numbers that we're looking at, all those questions that people have. You help alleviate and give them answers to the questions that they have.
So that's usually the biggest compliment I get is I make this easy. So health insurance can be stressful, it's confusing, and so that's one of the things I really enjoy is being able to take that stress off of people and just kind of explain it simply and be like, okay, you can't retire, you need to work a couple more years, or, you know, in some cases that you can, and this is how we're going to do it.
Is that the number one question you get most of the time am I ready to retire?
When we're talking to people below 65, yes. And just helping them, you know, figure out that game plan.
Are you seeing more people trying to retire just a little earlier, or are you seeing more people trying to work a little later?
It really depends. The biggest thing is education. You know, I've seen a lot of people that could have retired a lot earlier if they had the proper education and if they knew what options were available, and that's what, you know, I kind of specialize in.
Now, how can folks get a hold of you? I know that they're out there right now. There's questions. I can feel them. They're ready to ask you some questions. How can they get a hold of you?
So I work strictly on an appointment basis. So I do have an office here in Johnson City. I also go to people's homes, but all they need to do is call me on my cell phone, set up an appointment, and then we'll go from there.
All right. Andrew, Merry Christmas to you and yours. And Medicare Tips with Andrew Price, SFG Medicare. If you have questions, you want to reach out to Andrew, call this number right here on the screen, 423-737-1865. We'll be back with more Daytime. The preceding portion of Daytime Tri-Cities was sponsored by SFG Medicare.